That's just gross. I don't understand how this gets to that level. Nice. Did the old split. So nice. Hey, I'm Dr. Avi and I'm a dentist, and I grabbed some of the top videos on the internet all about tooth decay and things that are going on in people's mouths. In this video, I'm going to react to a bunch of them, and I'm going to try to break them down for you guys so that way you can walk away having learned something new. All right, let's get into it.
This is called baby bottle syndrome. Occurs when a toddler sleeps with a bottle or sippy cup filled with milk, juice, or sugary liquid. The top 4 teeth need to be removed.
Yeah, this is really sad to see because honestly, this is the parents' fault. A lot of parents don't know that you should not be putting your child to bed with a bottle of milk because the sugar in the milk can actually cause cavities, and over time, this is what it looks like. Nice. Did the old split. Yeah, so this tooth super broken down. They needed to extract it. And sometimes you would think that they would just grab the tooth and yank it right out. But in this case, they actually split the tooth down the middle because this molar has 2 roots. And when you do that, it makes it a lot easier to do. Props to this dentist for doing that. Oh my God, big hole. Oh. Yeah, okay, so that tooth is shot. Usually this happens when cavities form on the side of the teeth, and clearly this cavity went all the way through it, and they took that brush and they just jammed it right in there. I thought they were going to take the tooth out in this video with that thing, but clearly there's too much tooth structure there, so they're probably going to have to go in and remove it with some forceps. Best feeling. Best feeling right there. Look at that. Look at that. Okay, so that actually looked like it was a real tooth, but those aren't real gums. Okay, that's interesting video. But yeah, basically this tooth split down the middle. They went in, they popped off the top half of it that broke off, and then they went in and then just yanked this thing right out. That was smooth. And honestly, the most satisfying feeling doing extractions is right at the end when that tooth pops out. It's so nice. Oh my God. Yeah, that tooth is... It's probably hanging on by the gums, honestly. Yeah, that's gotta go. Gotta go. Gotta go. Very clear there. That tooth is rotten from the inside, and they're gonna have to take that thing out. And the reason why it's moving back and forth is because probably the root of the tooth inside is still intact, but that top crown portion of it, the part that you see over the gums, that's gotta go. Yes, that was nice and precise when they were getting in there with that little burr and getting the cavity out. That plastic thing that you see over there by the tongue, that is what's called an isolite or an isodry. And what that does, it is the best thing that dentists can use when they're working on you because it keeps your mouth open, keeps the tongue out of the way, and keeps the area nice and dry. Tube in the cavity. Keeps going. Oh my God. It causes more than bad breath. This is way more than bad breath. Look at that. A full-blown hole. Wow. Yeah, so that is what happens when you have a cavity in your mouth and you just leave it there because it's breaking down the tooth and you're going to get a huge hole and scooping all that stuff they were scooping out, just scooping. That is actually broken down tooth structure that is just rotten and sitting there. So this person probably before that tooth got pulled was not in any pain because the nerve had already been dead. This is why even if it doesn't hurt and you have a cavity, you should still get it taken care of.
Oh my God, look at this tooth decay. It is too serious. It needs to be pulled out. Otherwise, it may be infected by bacteria. Please take care of your teeth.
Yeah, I don't understand how this gets to that level. I think it's just you're avoiding the dentist, but guys, you got to go in and see the dentist. They're going to be able to catch this stuff. Now, this tooth split right down the middle, probably from a cavity, and then like a crack or a biting force that did it. And then you can also see all the yellow stuff around the tooth. That's all tartar that's built up over there. And this tooth is shot and needs to come out.
Let's see how deep is this.
Yeah, let's take a look. Still there. Still there. Oh, this is happening. This is gonna be crazy. Keeps going. Keeps going. Watch. Watch this. Some people would just stop drilling at this point. Yeah, at that point, there was still some decay in there, and obviously they cut the video off because it's super short. But you also see that staining on the other side of the tooth. That actually all probably connects underneath, because I don't think that's staining. I would guess that that is also a cavity, and so cavities can be super wild, guys. Oh my god! What this music is. that's just gross. Yeah, that's a massive cavity and rotten tooth, and I bet that smells worse than it even looks.
Wait for the black pieces to come out from
I love the relaxing. Boom. Yeah, you saw that? Oh, there it is. That's all under the gums. Eeh. That's that tartar buildup under the gums, guys. Floss your teeth if you want to prevent this stuff. What? All right, I don't know why they're not just pulling this tooth. There doesn't look to be any tooth structure left. Maybe they're just drilling it for the video, but yeah, those teeth are shot, and this patient is probably going to have to go with something in the realm of implants or dentures. Oh, the tongue. Yep. So when you get a crown, that doesn't mean that your tooth is never going to get a cavity anymore. All that means is the top of your tooth is covered, and you can still get cavities underneath the crown like this. And when that happens, that crown can come loose and it can pop off. A lot of patients think that they can just get that crown re-cemented and pop back on. But whenever patients tell me this or ask me about it, I always let them know there's a reason why that crown came off, and we have to check it out. In this case, a lot of decay underneath the crown, so it has to be cleaned out. And then you have to make sure there's enough tooth structure to actually support a new crown. In this case, it looks like they got pretty deep, and it might actually need a root canal.
Look at the cavities between teeth.
I don't see any.
Floss your teeth.
Oh, there they are. Yep. So basically they're doing some crown veneer preps here, and you can see those black spots in there. Those were the cavities. You couldn't really see just looking at the patient, but that definitely showed up on the x-ray, which is what they probably saw. And also if they were looking from the back of the teeth, they probably could have seen that as well. If you enjoyed this video or learned anything, check this one out. I go into even more crazy dental videos on the internet. I'll see you in there.